It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Hi folks, I'm Sam Lesante. Thanks for joining us. As I've been saying for years, folks, the Greater Hazleton Health Alliance keeps on getting better and better. I want to welcome all our new viewers in Schuylkill County once again, and again, you're in for a good treat today. We have a neurologist on the show. I'm going to learn a lot today, folks. His name is Dr. Shu, and he's a newcomer, not to neurology, but to the area. And Doctor, welcome to the Greater Hazleton area.
Thank you, Sam.
Tell me a little bit about yourself.
My family and I are originally from China. That was more than 20 years ago, and my wife and I both practiced over there, but to pursue an American dream, and so we moved over here, started medical training again, and I did my training in New Jersey, and then went to Boston, and I did my neurology training in Massachusetts General Hospital.
Now, I always ask the doctors this when they're in different divisions. What interests you to go into neurology?
There are two things. One is the mentor, the person or the attending that you follow during residency has a really big impact on me. The attending really explain the thing and make you interested, and really the brain is something very, very complicated, probably the most complicated organs in the body. That make me interested to know a lot of things. So second was there are a lot of conditions that affect different ages, and people often don't know what to do. So going to the medicine, you have to have a passion to care for people. So that was the motivation I got into neurology training.
That's terrific.
I still like it, yeah.
You better like it.
Yeah.
You better like it a lot. So your wife's a pathologist?
Yeah, she's a pathologist. She's in Geisinger.
Oh, that's true. And you have two children?
Yeah, two kids, two girls. One is 16 and, just like an average teenager. And
I'm surprised your hair is still black.
Turning white, studying. Yeah, and the other one's in TCMC, the medical school in Scranton. Yeah, she wants to pursue a medical career. We are okay, as long as they're successful, whatever career they want to
do
pursue.
what you want to do, what you like to do. Okay,
yes.
You said the word, Dr. Shu. You have to have a passion.
Yes.
And and that's I think is important because people really trust their doctors. And one thing that you don't want to do is once you lose your faith and trust in a doctor, then I think a lot of it's psychological.
Yeah, I agree.
Now, with that being said, okay, you're here in the Greater Hazleton area.
Yeah.
Now, with your background and how good it is, you could have gone anywhere. Okay. Why did you decide to come here?
Family is a big part of it. I finished the training in Boston. Then my wife, at that same time, my wife got matched in Hershey Medical Center, a residency program. So we moved to Hershey, stayed there until she finished training. Then we're looking for two positions, anywhere, any hospital can offer. So we moved to Lehigh Valley Hospital.
Sure.
Not too far away from here.
Yeah.
And we stayed there for some years. And now...
Were you practicing in Lehigh Valley?
Yeah, Lehigh Valley. I was practicing neurology for almost 5 years.
Oh.
Yeah, but I was commuting. My wife moved to Geisinger. Yeah, so I've had over years I have seen patients either in Hershey or Lehigh. People from Hazleton. They go to different places. I ask them, they say that because the local area community doesn't have such specialties, so they have to travel far. So I'm looking at it. It is a good opportunity
fabulous, yeah.
for practicing medicine, and also I think people don't have to travel too far anymore.
And we're finding that
there's a
more and
service.
more
Yeah,
doctor. We
yeah.
have, as I've said many times, we have a lot of great doctors in this area. I mean, fabulous doctors who decided to come here. And you'll find we have people from outside the cities, like coming from Allentown, coming here to our doctors, which is, you figure, well, why not go to Allentown or Philadelphia? But because of the quality of doctors, you know. Now, the topic today is seizures, okay, which I find quite interesting. And those people who are having seizures, they know what it's all about. But what are the definitions of seizures?
Seizure is defined as a clinical event or change that due to abnormal brain discharge, which can be detected on brainwave test. Most time it's a single event. It can last for seconds or minutes. Sometimes can last longer. Yeah. Typical or obvious type of seizure that people often know is a grand mal seizure.
A what seizure?
Grand mal seizure or convulsion.
Okay.
Yeah, whole body stiff,
Yeah.
turning blue, oral foaming, and a tongue bite, eye rolling back.
Doesn't sound good.
No. But there are many different types of seizures. Sometimes the seizure can be subtle. Yeah.
So seizure disorder and epilepsy.
Yeah, seizure disorder is another term that often used by public. What this means is that the person has two seizures or more that are not directly provoked by obvious identifiable reason. For example, very low glucose or very high temperature, those obvious reasons, yeah. Epilepsy is a similar term, just like a seizure disorder, but it's more used in medical society.
How do these things occur? I mean, like, are there any kind of preventative things that you could do to prevent seizures, or are you born with it? Is it something that you get hit in the head? I mean, what are some of the things that causes the seizures?
There are a long list of the things could cause seizures, from genetic, metabolic, and trauma, as you mentioned, and stroke. Sometimes it even could be medication and many other things. It's not very easy to sort it out. It's not always the case, although we wish we can find the reason for seizure for everyone. Yeah. In younger group, like in children, most cases seizures are due to genetic predisposition. On top of that, if there are some other things going on, more likely the person will develop a seizure. Yeah.
So you could be born with it?
Yeah,
Okay.
yeah.
But sometimes if you're, what is the average age that most seizures occur?
Seizures, that's a very good question. Similar question will be the incidence of a seizure at different ages. The incidence of a seizure is the highest at two ends. One is the youngest group, and the other is late stage of life. Middle, somewhere age 20 to 40, the incidence of a seizure is relatively low.
Is that
Yeah,
right? So
yeah.
you're going to get them most likely younger or older?
Or older,
And
yeah,
that
most
seems to be a
likely.
paradox, because you would think that if you're younger and you're getting them, it would go into the
Yeah.
20s and 40s. Why
Yeah.
is that? Does your brain activity change, or your
Yeah.
lifestyles? I don't know.
Different. It has to do with underlying medical issues. In kids, the most common underlying problem is genetic.
Okay.
Yeah.
That's something you can't avoid.
Yeah, that.
If it's genetic, you just have to treat it.
Yeah. That's not something you can do about it. It just happens. Sometimes it's spontaneous gene mutation, sometimes it's gene mutation that being carried over generations to generations.
Okay.
Yeah. There are also some other particular reasons why young kids have a high incidence of seizures. For example, birth-related injury. It's a big change from inside of the mother to outside the world. It's a big change. A lot of neonates develop seizures from that. Metabolic change, genetic change, and also possible injury. And all this contributed to the high incidence of seizure. Yeah, in young age group, I'm sorry. Yeah,
No,
yeah.
staying with the young age group,
Yeah.
okay? If you have a history in your family of seizures, all right, is it possible that your offspring will have those same seizures?
That's a very complicated question.
Well, make it easy. Don't make it complicated.
Yeah. See, it has to do with what type of genetic syndrome or epilepsy syndrome. Some family may have like a gene mutation that will give offspring higher risk for seizure or epilepsy, but not necessarily 100%. So
Can you skip a generation?
Yes, you skip a generation. And sometimes, let's say, if you have 5 kids, not all of them will develop a seizure or epilepsy. Maybe 1 or 2, and then next generation. Yeah, seizure type can also be different.
Is there any way I could tell, okay, whether I would be susceptible to having seizures?
Based on the family history?
Based on family history, okay, if for young people, and then let's say they're in their 50s now or 60s, okay, and nothing has occurred throughout their lifetime, is there any way I would be able to tell whether I would be prone to having any kind of seizures?
If, let's say, someone has a family history of epilepsy, that's, I would say, maybe someone needs to keep eye on it just to be sure, be familiar with the seizure presentations and symptoms. And for another person who doesn't have a family history, doesn't have risk for seizures, they don't need to worry about it. Yeah.
Staying with seizures, okay, when we're talking about how often do seizures occur?
The incidence of seizures is estimated somewhere 10 to 11%. That's very, very high. A lot of people already know, what seizure look like. Someone may already heard about it or even witnessed about it. So it is one of the common problems in neurology. Now, that's the seizure part. Epilepsy is one of the seizure disorder, type of seizures. The incidence is about 1% in general population, and no matter what part of the world, it's very similar.
What are some of the common types of seizure disorders?
It has a lot to do with age.
Okay.
Like in neonates, the most common type of seizure will be
In what age?
Neonates,
Okay.
A newborn.
Right.
Yeah, you may see a little twitching on one side, a little twitching on the other side. You never see full-blown convulsion.
Okay.
Yeah,
Now,
that's age-related presentations, right?
folks, if you just tuned in, I'm talking to Dr. Shu. He's a new neurologist in the Greater Hazleton Health Alliance, and you can contact him if you have any questions at 501-6470, okay? And we're very happy to have him in the Greater Hazleton area. When you're talking about the seizures and disorders, if no one ever had one, okay, and you were, you're at home and your child or whatever has some kind of a seizure, could it be confused with Tourette's?
Yeah, it could be confused with Tourette's. Some people with Tourette's may have repetitive movements. Tourette's means, or tic disorder means...
Is that part of a seizure?
No,
Separate,
no.
it's all separate?
Total separate.
Okay.
Yeah, total. Tourette's or tic disorder is categorized as a movement disorder, not the seizure disorder. because the person doesn't have change of mental status, doesn't have a consciousness problem. The person's fully aware of those movements. They just can't make them go away. Seizure, however, is different. Seizure is electrical discharge in the brain. The person may be confused briefly or complete loss of consciousness.
So if someone who was having seizures,
Yeah.
I'm sure are they treated by medication?
Most patients with seizures or epilepsy means that more than 2 seizures and without obvious reason, they will benefit from seizure medicine. Seizure medicine in general can control somewhere 75 to 80% of seizure. So far, that's the best option we have.
Having people who are prone to seizures, they know who they are, and they're on medication. Now, I'm sure there's degrees. In other words, if I drive a car, for example, and I have seizures, okay, I'm sure that before they give me a license, I have to be qualified before I'm having a seizure while I'm driving and kill someone, God forbid. Correct?
Yeah. Well, that comes to the issue of life and safety issue. Yeah. Unfortunately, seizure still affect some people, and it does have impact on someone's life. For example,
does a person have control? Let's assume a person is driving or in a situation that, if they have a seizure, can cause harm to not only themselves but somebody else. Is there something that they could do when they're going through the seizure, or are they out of it altogether? The seizure just takes it on its own life.
It has to do with what type of a seizure. Seizure can be divided into 2 big categories based on the presentation. One is generalized seizure. That means seizures due to the electrical activity or discharge of the entire brain. The person typically doesn't remember anything, lose balance, and so if the person has this type of seizure, that person should not be driving. Yeah, and because you won't be able to control anything. You even can't control your posture. Okay. Yeah, and no control of the body at all. But another type of a seizure is what we call as a partial seizure.
What kind?
Partial.
Okay.
That means that only a part of the brain is involved. Electrical discharge coming out from a part of the brain. Let's say on the left frontal area, that generate electrical activity typically causes some problems on the other side of the body. It could be hand, it could be leg. Yeah, if that's the case, the person is aware of it, they know they are having seizure, they are fully aware of it. If their history shows that the seizure typically lasts for some seconds, the person doesn't lose consciousness, doesn't lose control of their body, that's less dangerous.
Are any of these seizures life-threatening?
Some of them can be, yeah, like a convulsion. The person stop everything, breathing, turning blue.
Well, if someone's someplace, whether a restaurant or a meeting or whatever, a church gathering, and someone has a seizure, okay, we all want to help, especially if someone's having a heart attack, God forbid, or choking. Everyone tries to help somebody. What should you do if someone is having a seizure?
That's a great question. I have heard all kinds of things from family. So the things people really should avoid is intervene at whatever is going on with seizure. That cause more harm. That cause unnecessary injury. And things that being done by family or other people that I heard is some people may give CPR, Some people.
That's no good.
Yeah. Now you
You
don't
should
need
not
it
do
to.
that.
You don't
Okay,
need it
right.
to. Yeah. Some people may open patient's mouth and put the finger in or put the other stuff in. The intention is to keep airway open so the person can breathe.
Is that good or bad?
Well, but actually, it causes more problem.
Okay.
It may trigger vomiting.
Okay.
Yeah, when you put the finger down, and the person may bite their own tongue or bite your finger.
So what you're
That's
saying,
cause more problem.
what you're saying is, other than, because convulsion is a whole different ball game here,
Yeah,
right?
yeah.
But if someone's having a seizure, now the point is, how do you distinguish between a convulsion and a seizure?
Seizure, there are many different types of seizure. Convulsion is one of many different types of seizures. Seizure can be staring episodes, like a Partial seizure or absent seizure. Someone just look at you, stare for 5 minutes.
A lot of
no.
girls do that to me. Do they have seizures? And when all these girls are looking at me, it's, you're having a seizure, or oh, she's just admiring me. I thought that's what I didn't know.
That could be other reasons.
Yeah. So I'm sorry, I didn't mean to get off the track. So if someone's like staring, that could be a seizure.
Yeah.
Okay.
Yeah. So there are many different types of seizures. Some seizures are very subtle and very brief, not so dangerous.
Okay. The reason I asked that is now if someone's having a convulsion, where they're foam and mouth, and is there anything you could do then? What do you do for that person?
The best way will be put the patient on the side. That way.
Put them on their side.
Yeah. In case if the person throws up and doesn't cause aspiration pneumonia, which is a common complication during seizure.
Okay.
And just lay the patient on the side, that will help a lot. And you don't need to give CPR. Then the next things to do is to call 911 or someone, ask for help. Not to give CPR, because it will cause, if we look at the statistics, majority of seizure will stop within a few minutes. Seizure is a frightening event, but in most cases, it's a self-limited. It will stop by itself. When brains are having all kind of electrical discharge, when it's too much, brain shuts down. Seizure stops.
Okay.
Then it comes back.
Okay, so now how do we fix all this stuff? I mean, you're a neurologist here. You tell me all the seizures. What do you do to help these people out?
There are some options, treatment options. So far, the best treatment option is medication, which can help somewhere 70 to 80%, and that's the best option. If a patient fails to medication, then there are some other options. For example, surgery, or vagus nerve stimulator, or ketogenic diet, and some uncommonly used options. But medication is often the first choice. There are a little over a dozen medicines that we use.
Any side effects from these?
They're all different. Yeah, depending on which one we use. The common side effects will be possible side effect on liver, kidney, dizziness or headaches, even sometimes nausea, vomiting.
Now,
so patient needed to be monitored.
Right.
Sometimes can affect the white count, can affect the platelet, causing easy to bruise those things.
And what you're saying is they are, but however, you monitor those. They're getting their blood test.
Yeah.
And so you're knowing whether the medicine is having any effect.
Yes.
So at least you know if you see something's happening with the liver, then you're able to adjust.
Yeah.
Okay. So that's critical to monitor what's going on.
Yes.
What are those are the most common side effects to seizures, right?
Yeah.
Now, if I have a history in my family, that has had seizures, and I have newborn or whatever, is there any test that can be done on young children or family members to determine whether there's a possibility?
The risk for seizure?
Yeah.
Technically, it's possible to do it.
Have you ever done any of those?
But we, in clinical setting, we usually don't do it.
Okay.
The reason is that come to the issue of treatment. We don't treat people if the person doesn't have clinical seizure. Even you have risk for seizure, but you never develop a seizure. Now, the guideline from American Neurology Society also say that if the person has only one seizure, we may or may not start a seizure medicine. If a person has 2 seizures or more, then the person will benefit from long-term seizure medicine.
Can a person outgrow their seizures?
Possible, yeah.
What are the odds?
Yeah, the longer the person stay seizure-free, more likely you're going to outgrow. For example, if the person had a seizure 5 years ago, the risk for seizure is somewhere 5 to 10%. That's not very high. This is general speaking. Every type of seizure has a different outcome. Yeah.
What kind of lifestyle do people have that have these seizures?
Seizure is a very brief moment. So often people with seizures or epilepsy can have a normal life, just like someone else.
Can or cannot?
Can.
Okay.
Can, yeah. Because they just look normal, they function normal, except at the moment when they have a seizure, which is often very brief. Now, that's, I'm speaking about someone with relatively infrequent seizures.
Does diet have anything to do with any kind of your seizures?
That's complicated, yeah. Well,
Make it simple, Doc.
There's a treatment that's called ketogenic diet. If people with seizures fail to medications, let's say 1 or 2, and then...
My question is, we're getting short. If a person's obese, in your studies of seizures, were more people who have who are obese have more seizures than a normal person who was not obese, or if you're underweight or if you're over? Is there any rule of thumb here? Is there any statistics out there?
Yeah, it has to do with the age group. For example, like a younger group, the main reason for seizure is genetic. Not that much people can do about it. If this baby is small, this baby is...
Let's talk about
yeah. So the other end has to do with the general health and a stroke. Let's say if the person has diabetes, has high blood pressure, high cholesterol, history of a stroke, on multiple medications, then the person has high risk for seizure.
And if they're in that situation, and if they're smoking, and if they're drinking, and if they're overweight, and don't take care of themselves, the likelihood is that they're going to have something.
Yeah, so the best way is to stay healthy and have a balanced life, and that will also help to prevent those neurological issues like seizures.
Good. Well, Doc, thank you for coming on the show. I learned a lot today.
I
learned that I should not have a seizure. Like when I do this, it's not a seizure. Dr. Shu, folks, he's new in not new in medicine, in neurology, but he's new in the Greater Hazleton Health Alliance. I'm telling you, folks, we got some great doctors coming in this town. Before you decide to go out of town, check the doctors we have in this town. You're going to be very pleasantly surprised. I'm Sam Lesante. Remember, go to their website, the Greater Hazleton Health Alliance website, or go to ours at ssptv.com. You can watch this show 24/7. We appreciate the fine comments on our website. And don't forget, folks, watch the girls. It's a fun show. We'll see you next time.